Hi, my name is Caitlin Bridge, and this is going to be the AVMA task video for Clinical Pathology 2, Summer 2019. My ID number is 3119312. And now I'll be performing a modified knots test, and this is a type of heartworm test used to concentrate microfilaria. For this test, we'll need 1 ml of anticoagulated blood, 9 mLs of 2% buffered formalin, and then a tube for our centrifuge. I have a pipette to transfer. And then we'll also need microscope slides, cover slips, and new methylene blue stain. We're going to start by transferring our 1 ml of anticoagulated blood into our centrifuge tube. And then I have already pre-measured the 9 mLs of 2% buffered formalin. And we're going to add that to our 1 ml anticoagulated blood. And then we're going to let this sit at room temp for 1 to 2 minutes before we centrifuge. So now we're ready to put our tube in the centrifuge. And we're going to set the timer for 5 minutes. So now our mixture is done in the centrifuge, and we're going to pour the supernatant off. I'm going to pour it back into the original tube so it can be disposed of properly. And then we're left with our sediment. I'm going to take a drop of our new methylene blue stain. And add it to our sediment. And then with a pipette, just gently mix. Now I'm going to take a microscope slide and place 1 drop of our mixture onto the slide and add a cover slip. So now we have our slide, and we're going to use our microscope to scan and see if we can find any microfilaria. Just going to focus in at low power first. So far, nothing. I'm just going to thoroughly scan the slide. And after this test, this dog appears to be negative for any microfilaria. So the first fecal test we're going to perform is a fecal flotation. And for this, we're going to need a couple supplies. We'll need our vessels to actually put the fecal matter and the flotation solution in. I have some gauze for straining the solution, our fecal flotation solution, slides, and cover slips. So we're going to start by adding around 2 grams of the fecal matter to our cup. And then we're going to take our fecal solution and fill it around halfway to 3/4 and mix it really well. I'm going to take our second cup and put a piece of gauze over it. And strain our original solution. And this will just remove any large chunks of debris. Now that our mixture is strained, we're going to take the gauze out and then fill the cup all the way up until an inverted meniscus forms. And then once we have this, we're going to take one of our cover slips and place it right on top. And now we're going to let this sit for 10 to 15 minutes while the eggs rise. So it's now been 15 minutes and we're going to take our cover slip off and carefully place it onto a clean slide. And now we can examine this under the microscope. Now we're going to perform a fecal flotation with centrifugation, and this starts out the same way as just the basic flotation. So we're going to start with around 2 grams of fecal material. And we're going to place that into our cup and fill it 1/2 to 3/4 with some fecal solution, flotation solution, and thoroughly mix it. Now we're going to use a piece of gauze and strain the mixture to get any large debris out. And instead of letting it sit in here, we're going to add it to a centrifuge tube. Now we're going to take this and centrifuge for 5 minutes. So now our mixture has been centrifuged for 5 minutes. We're going to go ahead and fill it the rest of the way with flotation solution and fill it to the top until an inverted meniscus is formed. And then place our cover slip over the top and let it sit for 10 to 15 minutes. "15 minutes has passed, so now we can carefully remove our cover slip and place it onto our slide. And now it's ready to be examined under the microscope. Now we're going to perform a direct smear. So we need a microscope slide, and then we're going to take a few drops of sterile saline and place that on the slide. And then mix that with an equal amount of fecal material. And then place a cover slip over the top. Ideally, this will be thin enough for you to be able to read through it. And then your cover slip, and you can look at this under the microscope. So now we're going to perform our last fecal test, and that is sedimentation, and this is typically used for large animal fecals where some of the eggs may be too heavy to float. So we're going to start the same way by transferring around 2 grams of fecal material into our cup. And then filling around halfway with our flotation solution. And then thoroughly mixing. And we're going to use a piece of gauze and strain our mixture. And this would be especially important for this test if you're doing it on large animals, since they're going to be eating a lot of hay and there could be a lot of large debris in their fecal matter. Now we'll transfer this to a centrifuge tube. And we'll centrifuge for 5 minutes. You also could leave this sit for half an hour if you had the time, undisturbed, and that would do the same thing. So our sample has centrifuged for 5 minutes. And now I'm going to pipette off the excess liquid. Leaving just the sediment behind. Once you have the remaining sediment, you just want to place a drop onto a clean slide. And place a cover slip on the top. and now it's ready for examination under the microscope. I did use the same canine sample for all 4 of these fecal tests, and where it was able to find roundworm eggs after 2 of the tests, the flotation and the centrifuge flotation. We're going to get a free catch urine sample on this dog, and ideally we're going to catch midstream to avoid some contamination. And we'll just draw it into a sterile syringe. Yay! Ideally, with the free catch sample, you'd want to get the first morning urine, and our patient, her urine was very clear, healthy, and a medium color yellow. Next, we're going to perform a cystocentesis on a cat, and cystos are used primarily for sterile urine samples if we wanted to do a culture, or when we're unable to get a urine sample free catch. A lot of the times in our hospital we do them on cats since it's a lot more difficult to catheterize or obviously get a free catch sample from a cat. So there are a couple ways you can do it. Ultrasound guided, where you use the ultrasound probe and visualize the bladder, and then you can see that where your needle is being placed. A blind stick, or palpation and then isolation, so you feel for the bladder and hold on to it while you stick with your needle. Typically it's a 10 or 20 cc syringe and a 1 inch or a 1.5 inch 22 gauge needle. Here we usually use the 1.5 inch 22 gauge needle with either we sometimes use a 6 cc syringe on a cat, otherwise a 10 cc. And now we'll be doing our cysto on our kitty. With the cystocentesis, the position of the patient is dependent on what method is being used. The patient that we're using for our ultrasound guided cysto is on her back in a V-trough, and that's typically how we do the ultrasound guided. For the blind stick or the palpation and isolation, they are usually on their side, but some people like to also perform that on their back. So we're going to do a cysto on this kitty, ultrasound guided. So we started with putting alcohol on its abdomen and visualizing the bladder. We've got a 6 cc syringe with a 22 gauge 1.5 inch needle. And we're going to put a new needle on the syringe before we put the urine in our sample tube. Now we're going to be performing a catheterization on a male dog, and there are a couple different choices we have for catheters. We'll be using today a polypropylene catheter, and this is a 5 French longer catheter that we would use for a dog. We also have smaller Tomcat catheters. We typically in our hospital will use the polypropylene catheters for just a quick catheterization to get our urine sample. In cats, we use the polypropylene to unblock a male cat. There also are red rubber catheters, and these we use a lot of the time in a blocked cat after we've already unblocked them. We'll use this to leave the catheter in for a couple days. These are less irritating to the patient. And there also are Foley catheters, and these are used if you're going to need the catheter in for an extended period of time. They have a balloon at the end that can be filled up with either air or water, and that'll wedge it in the trigone of the bladder, and that way it stays in place for the duration of the time. So we're going to catheterize this dog. We're going to clean his penis first. I have some Nolison. Sorry. I drew up some sterile saline just to rinse it off. Sterile gloves. A syringe. And our sterile lube. Open it up.
Good boy. Good Jake, good dog. It's okay, good dog.
And then we're going to use a polypropylene 5 French catheter.
Good boy.
Just roughly measure. And into the sterile lube.
Okay, buddy. Good boy, buddy. So good. So good. Gently insert.
And you just want to discard the first few milliliters of urine just to avoid any potential contamination. And then gently collect. Remove the catheter.
Good dog. Good dog. Yes.
Good job, Jake. I hate these gloves. Next, we'll be getting an ear cytology, and a lot of patients present in our clinic for ear issues, shaking their head, scratching at their ears, discharge. Sometimes their ears are very swollen, and we'll want to be careful. In that case, we use clean cotton swabs to get a sample from each. You always want to do both ears, even if only one is affected, and then that way you can compare and see what the dog's normal ear or cat's normal ear looks like, and what normal bacteria or yeast they have to compare to the bad ear.
Improper restraint. And you're looking at the patient.
If he ever gets rid of this case, then come with me. He's got a standing invitation to the nurses.
Uh-huh.
So we're going to get an ear cytology on this kitty. He has a chronic polyp, so he always deals with infections. We're going to start on the better ear with our swab. And this is the left ear, so we'll snap it to the difference. This one's very swollen. Then we have our slide. We want to roll it, not rub, so we don't damage any cells. and then we'll stain it.
All done?
So now we're going to stain our ear smear slide, which I have labeled with the animal's name and left and right ears. Here we use a diff quick, and we're going to put it in our fixing solution for 2 minutes to start. So 2 minutes has passed for our second step. We're going to put it in the stain for 1 minute. And lastly, we're going to do 30 seconds and set our timer. 30 seconds has passed. I'm going to take the slide out and just rinse it under tap water. Dry it off. And then we have our stained slide. Now we're going to look at our slide under the microscope. And in this sample, we know our kitty's left ear was the bad ear, so I'm going to start with the right side. This one overall is relatively normal. So I'm going to switch to the left ear. So already we're seeing a lot of cocci bacteria. A lot. Occasional yeast, but for the most part loaded with cocci bacteria. Now I'll be discussing a fungal culture and how to achieve one. Our clinic, we send all of our cultures out, so we don't have actual testing medium, but I'll go through how you would use testing medium versus what we do here at our clinic to get the sample ready to be sent out. So to achieve the culture, you can either use a toothbrush method where you would brush the area, or sterile hemostats, and with those you would pluck some of the hairs out. Here at our hospital we also have a clean test tube because that's where we'll place the hairs once we pluck them out. When you're ready to actually do the microscopic testing of your plate, you would need some cellophane tape and microscope slides. Our patient today for testing presents with no itchiness, but he does have a quite large hairless region. A lot of the times with a fungus, patients will be itchy, there'll be crusts or lesions. He has none of those, but the hair loss is unexplained, so to cover bases, we are going to do a fungal culture on him. So first we're going to use our hemostats to pluck some hairs around the outside of the lesion. And we're going to place those right in our test tube. You want to go right on the edge of the lesion. In a dog that was actually itchy or had sores, you want to look for some broken hair shafts and things that where more of the organisms are. So we're going to get a sample from down here as well. If you had the culture medium, you could put these hairs, press them right into the medium. So now that we have our sample, that part's all set. The other method is to use a clean toothbrush. So we're going to take it out of the plastic. In an animal that has the lesions, you want to brush around the area. You want to start at the hairs first, and then after you brush the hairs, go to the inside of the lesion. If we had the medium, you would push the toothbrush into the medium just below the surface. Here we send the whole toothbrush out to be cultured. Alternately, you could also cut the bristles off with the hair and put those in the testing medium. In an animal that has cleared up lesions or is itchy all over and you're not sure of the source, you could brush the whole animal with the toothbrush and send that out to see either if the fungus is resolved or if there's something we're missing. After the culture grows, you would want to take, in order to look microscopically, you would take your cellophane tape and push it right down on the medium and get those samples, and then place the tape directly on the microscope slide. And then you can look at it under and see any evidence of spores or what the organisms growing are. Now we're going to perform a skin scraping on a dog, and there's a couple reasons you might want to do this, either to check for infections such as bacteria or yeast, but also to check for mites, Demodex or Sarcoptes. So the supplies needed are microscope slides, mineral oil, blade, or a spatula. And so today for our sample, our doctor wants a spatula, dry. Alternately, you can use mineral oil, a drop on the slide, dip your spatula into it. With either the blade or the spatula, it's important to keep it at perpendicular to the skin, so that way you don't hurt it. A superficial scrape is more what we're going to be doing today, just to get the top layers of cells off. A deeper scrape, where you actually start to make the cutaneous layer of skin bleed a little bit is what you'd want to do if you were looking for mites. So we're going to do a skin scraping on this dog that's got a skin infection. So I have my spatula blade. I'm just going to look for a crusty spot over here. Scrape the first layer. And then smear it on a microscope slide. Okay, one more thing, John. So now we're going to evaluate our skin scrape. And we're going to start with the microscope and low power and focus in on that first. And then next power. So there obviously are a lot of skin cells, but it also looks like there are some cocci bacteria. I'm just going to use a drop of oil and go to high power. Just continue scanning the slide. But this dog's skin is definitely loaded with bacteria. Now we'll be performing our necropsy. The doctor that will be performing it is Dr. Jamie Hopper. And a few reasons you would want to perform a necropsy, obviously to determine cause of death, but also you are able to take samples to see what sort of infectious diseases, viruses could have contributed to the death, and to know if there's any public health or any risk to any other animals in the household. And by doing that, so we're going to do our necropsy now. This is us in our personal protective equipment, our mask, our gowns, and our gloves. And this is our rat.
Okay, so we're going to start with a cut down midline. Go ahead and hold tension on that side.
External findings first.
Oh, so external findings are, this is a female rat that has died from a fractured neck. Otherwise appears healthy. So we're going to start going internally here. So we're going to make an incision down midline. You can hold the top part back. So now we're going to reveal both cavities just by peeling back the skin.
She's getting this rat.
Alright, so now that we've revealed both cavities here, you know, we can look for bruising or any other weird things that are here. Okay, so now we're going to enter the abdominal cavity. And we can enter up the chest cavity up here too. Okay, so we can look for any abnormalities in the abdomen here. Obviously, organs and stuff up here are pretty well intact and everything in there. So we can just kind of take a look around, heart, chest cavity, liver, intestines. So take little samples from each.
We have our biopsy jars with our 10% buffered formalin.
All right, we can continue to look around. So liver looks pretty good. Here is stomach here. And here is more intestines. Another organ to biopsy would be spleen. So here is spleen. So we'll take a sample from spleen as well. So basically we just kind of look around, pull the intestines out, and check the length of them for any abnormalities or any areas that look abnormal or diseased. Here's colon. There's all colon there. And again, stomach up here. So everything looks pretty well accounted for in the abdomen. And again, in the chest cavity, we could also take samples if we needed to of the heart up here and the lungs, which are all retracted and small right here.
And then we have our jars labeled with the patient's name. Since we used a rat, it doesn't have a specific name, our date, and then the area that it was taken for both of them. Next, we're going to perform a vaginal cytology, and there are a few reasons you might want to do that in a dog. In an unspayed female, you can determine the stage of estrus she is in by the type of cells you would find. In a spayed female or unspayed female, it would also be useful in looking for vaginitis, or if there's any cancer going on, you can look under the microscope and determine what type of cells you're seeing.
Okay.
So we're going to do our vaginal cytology on this dog, and she is under anesthesia. So you can do show the monitor, please. Thank you. We're just going to start by scrubbing her vulva with some chlorhexidine. And then keep her tail out of the way. Open our sterile swab. We have some sterile saline just to wet it. We're going to insert the swab at a 30-degree angle and then go vertical. almost 180 degrees into the anterior vagina. And then take our samples. And withdraw the swab.
Do I pause it now?
Okay. So now we're gonna make our vaginal smear. Just gonna gently roll the swab on the slide. Not rubbing, just rolling, so we don't damage any cells. And then we'll go stain it. So now we're gonna stain the slide. I'm gonna fix it for 2 minutes. And now 2 minutes, or 1 minute. And 30 seconds. And just rinse it off. So now we're going to examine our vaginal smear, and unfortunately I didn't have access to an unspayed female dog. So this dog is spayed, so we're not going to be able to obviously tell if she's in any estrus because she's spayed, but we can look for any other abnormalities.
Actually, all four of them are mine, Janice, because I brought COVID in too. I wanted to add Pepsi to this, but that's what I need over today.
So it looks like a lot of vaginal epithelial cells.
Okay, you want me to do that now? Okay.
Then I'm not seeing any other evidence of any abnormalities, any large quantities of bacteria, anything that would indicate she's anything other than a healthy spayed female. So our patient that we used for our vaginal cytology was a spayed female because that's what we had access to. But most commonly when doing a vaginal cytology, it's to look at what stage of estrus the dog is in and try to match that up with the blood progesterone levels to give an idea of when to breed the dog. So the first stage is anestrus, and in that stage, you're going to be finding mostly non-cornified epithelial cells on the slide. Next is proestrus, and in the beginning of proestrus, you're going to be seeing an increase in erythrocytes and basal and peribasal epithelial cells. As proestrus continues, there is a decrease in erythrocytes, and the epithelial cells begin to show evidence of cornification. Once in estrus, you're going to see all squamous epithelial cells that are cornified and usually anucleated, and then you move on to metastrus. And in metastrus, the cornified epithelial cells are replaced with non-cornified squamous epithelial cells, and cytologic debris can be seen as well. So the last task is going to be a manual cross-match, and this is performed before doing a blood transfusion on a patient in the hospital. So you would need blood from your donor and your recipient, and this makes sure that there would not be any reaction when the transfusion is being given. A manual cross-match consists of the major cross-match and the minor cross-match. The major cross-match is taking serum from the recipient and mixing that with packed reds of the donor and making sure there's no hemolysis or reaction. And a minor cross match is the opposite, using serum from the donor and mixing that with packed reds of the recipient. Now we're going to begin our manual cross match. I have blood samples from 2 dogs. For our cross match, we're going to need blood from the donor dog and the dog that would be the recipient. We're going to need EDTA blood and blood that we had placed in a serum separator. I did already spin the serum separator blood down and pull off the serum. We also need clean test tubes and centrifuge tubes, as well as 0.9% saline. Since we already spun down the serum separator tubes, we also are going to centrifuge the EDTA tubes. So we're just going to put those in the centrifuge and make sure they're balanced and labeled. The centrifuge is done. So we have plasma that we're able to decant from the samples. So now that our EDTA samples are done spinning, we're going to decant the plasma. Leaving just the erythrocytes. You want to make sure that you use a different pipette to decant the donor versus the recipient. So now we're going to take our clean centrifuge tubes that are labeled and place 1 to 2 drops of the erythrocytes in the tube. And then fill the rest of the way with our sodium chloride solution. And we're going to do this same procedure for our recipient dog. I've already decanted his plasma, leaving the erythrocytes. And same thing in our clean labeled tube. And then our sodium chloride. So now we're going to begin the washing procedure, and we're going to take these and centrifuge after we mix them for 1 minute, and then decant the supernatant. And we're going to do this 2 more times, so 3 times total. So after our first wash, you can see what we're left with. So we're going to decant the supernatant carefully. And then refill with the sodium chloride solution to wash a second time. So we're going to do the same thing with the other sample. So we're going to recentrifuge both of these for 1 minute and then wash a third time. So this is after our final wash, and you can see that the supernatant is clear and colorless, so this indicates that the erythrocytes have been thoroughly washed. So now I'm just going to decant both samples. Now we're going to take 0.02 mLs of our packed erythrocytes. And place this into a clean labeled test tube. And we're going to do this for both dogs. And then we're going to add 0.98 of sodium chloride to each tube. Now we're going to begin the major cross match, and we're going to take 2 drops of the recipient's serum and 2 drops of the donor's cell suspension and place it in a new test tube. So we have the recipient serum, and we're placing that 2 drops in a clean test tube. And then we have the donor's cell suspension, and we're going to take 2 drops of that as well and add it to our tube. And mix gently. And I'm going to label this as our major cross match. For the minor cross match, we're going to take another clean tube and place 2 drops of the donor's serum into the clean tube. And 2 drops of the recipient's cell mixture. And mix gently and label this as minor. To set up our control, I've got 2 new tubes labeled with the donor and recipient's name and control on them. And we're going to take 2 drops of the recipient's serum and 2 drops of their cell mixture and add it to the same tube. 2. And 2 drops of the cell mixture. And we're going to do the same thing for our donor. So I have his tube as control, his serum, and 2 drops of his cell mixture. I now have my labeled tubes with our controls and our major and minor, and I'm going to set them in a rack and let them incubate at room temperature for 30 minutes. So our samples have sat at room temperature for half an hour. I'm now going to centrifuge them for a minute, and then we can check for hemolysis. So as expected, you can see, it's a little hard to see, there is no hemolysis in our control samples, which is what we wanted. So in our major cross match, there also is no hemolysis. Same for our minor cross match. And this actually is what I expected, because our donor dog is my own dog and he's already been tested and he is a DEA negative. So with that being said, this blood transfusion could take place.